Hello everyone, my name is Hannah and I'm one of the health educators with health education at OCO. And in this module, we will be going over STDs and STIs. So let's start with the basics. What does STD and STI stand for? Well, STD stands for sexually transmitted disease, and STI stands for sexually transmitted infection. They essentially mean the same thing, and I will use these terms interchangeably throughout the module. But the reason we are trying to shift toward using STI over STD is because it is technically more medically accurate in most cases, and the term STI carries less of a negative stigma or feelings of shame compared to the term STD. Now, I want you to pause this video and list all of the STDs or STIs that you can think of. Now that you've hopefully brainstormed, let's go over them. Some you may have thought of include chlamydia, gonorrhea, syphilis, genital warts or HPV, herpes, HIV, trichomoniasis or trich, hepatitis, and pubic lice or crabs. How do you think people get STDs or STIs? Well, the first thing you probably thought of is sex, hence the term sexually transmitted disease or infection. This includes vaginal, oral, and anal sex. The next two methods of transmission we talked about a lot already when we discussed HIV, and these are mother to child, either during pregnancy, birth, or through breastfeeding, and sharing needles. The last way a person can contract an STD or STI is through intimate skin-to-skin contact. So, who can get an STD or STI? The answer is anyone. Anyone who has sex can get an STI. STIs do not discriminate. You may have heard that only certain kinds of people get STDs or STIs, or that people with STDs are dirty and damaged goods, but this is untrue. I really challenge you to change your thinking on this because every person who is sexually active has a chance of contracting an STD or STI. What do you think are some of the symptoms of STDs or STIs? Some that you may already be familiar with include burning when urinating, sores, blisters, warts, or pimples near the genitals or mouth, an unusual discharge from the penis or vagina, rash or itching in the genital areas, frequent urination, pain in your abdomen, but the most important and most common symptom are no symptoms at all. This is called being asymptomatic. It's important to note a person who is not showing symptoms can still pass that infection to others. So how can you prevent yourself from getting an STD or STI? Luckily, there are preventative measures you can take to lower your risk of getting an STD or STI. These include using barrier methods such as a latex or polyurethane condom or dental dam every time you have oral, anal, or vaginal sex. The most reliable prevention method is abstinence, or not engaging in sex of any kind. Okay, so now we're going to go over the types of STDs or STIs. There are 3 different types of STDs or STIs, and I'll briefly go over the symptoms for each of these, but remember that all of them can be asymptomatic or only show 1 to 2 or maybe not all of the possible symptoms. This is going to feel like a lot of information is being thrown at you at once, so I encourage you to take notes because there will be a quiz at the end of this module. The first type of STDs I'll go over are bacterial STDs, which are STDs that are caused by a bacteria, and these are curable with antibiotics. I'll talk about chlamydia and gonorrhea together because they share a lot of the same symptoms. These can include discharge. If you have a vagina, some vaginal discharge is normal, but if you notice a change in color, consistency, or odor, that's a sign you should get checked out by a doctor. If there is any discharge coming out of a penis at all, you should definitely get checked. Other symptoms can be burning or pain when urinating and pain in your abdomen. Lastly, it is so important to get treated because if chlamydia or gonorrhea are left untreated, they can lead to serious infection and even infertility or the inability to have children in both men and women. And the last bacterial STD I'll go over is syphilis. Syphilis has 3 stages. The first is a painless sore in the genital area or mouth that goes away on its own without treatment, but the bacteria stays in your body. The second stage is a rash, typically on the hands and feet, accompanied by flu-like symptoms. At this point, syphilis can still be cured. However, if it is still left untreated, it can reach the third stage, which can cause irreversible, serious consequences like heart disease, brain damage, and blindness. The second type of STDs or STIs I'll go over are viral STDs, which are caused by a virus. These STDs are not curable, meaning once you get it, you have it for life, but they are manageable with medication. The first STD I'll talk about is herpes. The most common strains of herpes you've probably heard of are herpes simplex virus 1 or 2, or more commonly known as oral and genital herpes. Typically, HSV-1 causes oral herpes or cold sores, and HSV-2 causes genital herpes, but either virus can cause either kind of herpes. The most common symptom of genital herpes are painful blisters in the genital region, but you may also experience burning or pain when urinating, itching, or flu-like symptoms. Herpes is very common, and although incurable, it is manageable and not life-threatening. The next viral STD I'll go over is HPV, or human papillomavirus. HPV is different than HIV, and you shouldn't confuse the two. There are over 100 strains of HPV, some of which cause genital warts and certain cancers, such as cervical cancer. The Gardasil shot is a vaccine that protects against the most common wart and cancer-causing strains of HPV. You should get vaccinated before you become sexually active. It's important to note that most people who are sexually active will have a strain of HPV at some point in their lives, but typically it goes away on its own. The third viral STD is hepatitis B. Most people receive the vaccine for Hep B at birth, but since it is sexually transmitted, we'll go over it. Symptoms include jaundice or yellow skin, dark urine the color of Coca-Cola, and flu-like symptoms. The last viral STD we'll talk briefly about is one I hope you are familiar with, and that's HIV, or human immunodeficiency virus. As you know, HIV is the virus that causes AIDS. People used to think HIV was a death sentence, but now we know a person who is HIV positive can live a long, otherwise healthy and normal life with the help of certain medications. Before we move on, what do you notice about all the viral STDs? They all begin with an H. This is a good way for you to remember which STDs are caused by a virus and are manageable but not curable. The last type of STD I'll go over are parasitic STDs or STIs, or STDs that are caused by a parasite. These are curable. The first one is trichomoniasis, or trich for short. These symptoms include burning, itching, and a foul-smelling vaginal discharge. Folks with penises rarely have symptoms. Pubic lice is the last STD or STI I'll go over. You may know it as crabs. The telltale sign is an intense itching in the genital area. Okay, so now we're going to go over some important facts and reminders. Number 1. STDs or STIs increase the chance of HIV infection. This is because some STIs cause open sores, making the body more susceptible to the infection. Number 2. This is a big one. Often a person who has an STD or STI will not have any symptoms. Alright, so how can you tell if someone has an STD or STI? Often, and I would argue most of the time, you cannot tell. You may see some visible symptoms like sores, blisters, warts, or pimples, and there could be an unusual odor or discharge. But the only 100% way to know if someone has or you have an STI is by getting tested and communicating with your partner before engaging in sexual activity. Now I'm going to ask you to pause the video and complete the What STD/STI Am I quiz in this module. When you're done, come back to the video and we'll go over the answers. Okay, so number 1. Anyone can have me and not know it, often because they have no symptoms. This answer is all of the STDs or STIs. It is possible for any STD or STI to be asymptomatic or not have any symptoms. Number 2, I can be cured with antibiotics. Answer: Chlamydia, gonorrhea, and syphilis are all caused by a bacteria and are curable with antibiotics. Number 3, I can cause a discharge from a penis or vagina. Answer: chlamydia and gonorrhea typically cause discharge from the penis and can also cause a vaginal discharge. Number 4, some types of me cause warts and some types can lead to cancer. Answer: human papillomavirus or HPV. Some types of HPV cause genital warts. The high-risk types of HPV can cause cancer of the vagina, vulva, penis, anus, cervix, and even the throat. This is why that Gardasil shot, the vaccine, is so important. Number 5, I cause blisters or sores in the genital area. Herpes and syphilis. Herpes infection causes painful blisters that can come back from time to time. Syphilis typically causes a painless sore that heals without treatment. Number 6, this STD has no cure. Answer: HIV, HPV, herpes, and hepatitis. These STDs are caused by a virus and can be treated, but they cannot be cured. Remember, those are all the STDs that start with an H. Number 7, this STD has 3 stages. Syphilis. The first stage is a painless sore that heals without treatment. The second stage is a rash, typically present on the hands and feet. The third stage affects internal organs and can cause brain damage. Number 8, if I am not treated, I might make it hard for someone to get pregnant or to get someone else pregnant later on. The answer: chlamydia and gonorrhea, if left untreated, can travel through the uterus and fallopian tubes or through the tube in the rear portion of the testicles and cause infertility. This can happen even if a person does not have signs of infection. Number 9, I can infect people through unprotected oral or anal sex. Answer: all of them. Chlamydia, gonorrhea, syphilis, HIV, herpes, and HPV can all be transmitted through oral sex, so a person's mouth on someone else's genitals, or through anal sex, which is a penis in someone else's anus. Hepatitis B is also transmitted through oral and anal sex, but most people are vaccinated at birth and through childhood. And number 10, I am the most common STD among young people who have had sex. And that is HPV. It is the most common. 1 in 4 young women and 80% of all sexually active people will become infected with HPV at some point in their lifetime. For most, HPV clears up on its own without treatment. Chlamydia and gonorrhea are also very common. That is the end of our STD and STI module.